the message, group message, okay, invitation message. Send it to all the groups, please. Morning classes. Yeah, the message, group message, okay. Okay. Yeah, so Chabrani says she will do after 30 minutes. Muttu says after 2 members. What is this? The time it is coming. Yeah. Yes. So Deepak, you can take the second speaking session also if you want in continuation. I'm going to take 2 speaking sessions for you now. Right. Yeah. Yeah. Good morning, Santhya. Okay. Yeah. Deepak, your video is not very clear. So can you come with a clear video? Clear. Okay. Yeah. Fine. Yes, we can start now, Deepak. Hello, Deepak. Deepak Moily, unmute. Yeah, are you ready?
Yes, sir.
Yeah, you can start now.
Good morning.
Good morning, nurse.
My name is Deepak. I'm working as a nurse in this clinic. Please be seated.
Thank you very much, nurse.
I think you came with your son. Is that right?
Yeah, of course, nurse.
Okay. Could you tell me your name and your son, please?
Yeah, my name is Martina Hingis and my son's name is John.
Okay, nice to meet you. Yes, tell me, what made you to come here?
Yeah, actually, doctor, I came here for my 5-year-old son. You know, he got an injury and he was actually playing in the garden and unknowingly he put his, he got hurt and playing in the garden. And I think he needs your attention. What can I do for that, nurse?
Okay, I'm very sorry to hear that. First, I will assess your son's wound now. I'll examine now. Yeah, the wound looks very little bit deep. I need dressing, so I'll clean with the sterile dressing and solution, and I'll apply ointment. Is that okay?
Yeah, nurse, definitely, that's fine. But is it problematic, nurse? Is it difficult for my child? What is going to happen?
Oh, now I've done dressing, but to avoid infection, he gives injection called injection tetanus.
Is that
Would you?
really necessary, nurse? Why do you want to give this injection? Actually, my son is afraid of injections.
As I said earlier, his wound is deep and some foreign bodies present over the wound. So avoid infection. Or this injection tetanus is required.
Okay. If that is so important, okay, nurse. And what are the things that we are supposed to do here?
Okay. So with your permission, I'm giving tetanus injection because it is like a precautionary measures. If it gives injection, there is a your child will be free of infection and it doesn't get any other issues. So it is and is the valid for 1 to 2 years. Injection tetanus. If he in case during the this period, if he fell down or got any injury, there will be any other side effects. So better to give injection tetanus. So it is one of the precaution step for this child, 5 years child old boy.
Okay, nurse, but what are the side effects of this, injection? Will there be any
Uh,
negative effects or consequences because of this injection?
Definitely some few side effect may child may get, but do not worry. Doctors advise some medication for that. So you may get some tiredness, nausea, or allergic, but it will be for 1 day. So no much pain. So is it okay, Mr. Martina, if I give injection, right?
Yeah, nurse, you can give definitely. I
Okay,
agree for the injection.
okay, Martina, thank you for agreeing that. Please do not be tension. We are here, so an injection will be not much painful. Um,
Okay, okay, nurse, but I have one doubt here. What
yes,
are the advantages of this injection? Okay, you said I give, but what are the advantages and how it is going to help my son? Can you give me a detailed explanation?
yes, definitely, Mr. Martina. If the 5 year child or 5 to 10 years old children, they may get prolonged to get fall or any get small accident. If we to avoid to get precautionary, the injection tetanus is advised. So it is like one of the vaccination to if it's not given in the during the regular vaccination period, you can give it now. Are you
Okay.
following, Mr. Martina?
Yes, I understood the importance. Okay, nurse, now you can give the injection. I agree for that.
Okay, Martina, do you have any other concern?
Yeah. You have also given the side effects and other things more. Okay, so you are going to be with my son. Then what if any other negative consequences are seen? What are we supposed to do?
Definitely not, Mr. Martina. Your son is absolutely normal now. If once he get vaccinated, he'll be they'll complete with treatment, and he can come for review for next after 2 days. Now is like I will be giving injection tetanus.
Okay, nurse, thank you very much. Is there anything else that I need to know?
Uh, uh, yes, no. Your son
Some
is
do's
fine.
and don'ts. What should we do in this testing period? When will we know that he's out of problem or anything?
Your son is right now normal and we wound is clean now, there is no infection, right? And after and I gave injection of tetanus, so we can come for you after 2 days for dressing.
Okay, okay, nurse. Thank you very much.
Thank you, Mr. Martina.
Thank you, Mrs. Martina. Okay, fine. That's very nice. Right. Yeah, Deepak Moily. Right. You are doing well, no doubt regarding that one. So, but you can exactly explain in a clear manner. For example, you can say like this. So I can see the problem, I can see the site. After checking, we cannot immediately say, but there are chances of infection. I do not say that he is definitely infected, or I cannot be sure about it. Okay, but there are chances of infection. So even if it is 1% chance, we don't know. So we are not sure whether he is infected or not infected. So as a preventive measure, we can take tetanus vaccine. If he is not infected, that's well and good. But what if he is infected? We don't have any guarantee. So for that one, to be on the safer side, tetanus injection is a yeah. So we are not sure. It's not easy to identify whether he has the infection or not. It's not that easy to identify in this situation. But to be on the safer side, we can give one tetanus injection that will put us in a safe side. So if you do not have tetanus infection, that is well and good. But what if you have tetanus? Sorry, what if you have infection? So to be on the safer side, we can take tetanus injection. So that is what I suggest you, and the doctor has recommended the same thing. So now you can relax. Once you take tetanus injection, you can relax. So it will take care of everything. So that is, prevention is better than cure. So once you get the infection and then afterwards you give the treatment, better. We don't know, but even before something happens, we give advanced preventive measures. So that is good for your child. That is what I suggest. And if you have any doubts still, I am ready to explain you, or you can even talk to the doctor and he will give the proper suggestion. So this is the way how you can expand. The next one is, there are definitely some mild side effects. Okay. There are definitely some mild side effects. So this potential risk of tetanus. Everything has some advantages and disadvantages, and tetanus is of no exception. Every medication, okay, so it is not 100% perfect. So it may lead, every medication may have some alternative side effects. For example, like you can say difficulty in breathing, or muscle stiffness. Okay, so there are some side effects also. What are the side effects? Feeling achy, tired, mild nausea, lightheadedness. So these are some side effects. When you take this tetanus vaccine for some time, you may or may not, but there are chances. That is what I tell you. So you may feel some ache. Okay, then you may feel tired and you need rest. So the next one, you may experience mild nausea also. So lightheadedness, as if once you face these things, you may feel worried and upset. But well in advance, I'm telling you, there is nothing to worry. For the time being, for some time it will be there. Then once you regain normalcy, or normalcy, then everything will be fine. It will be these side effects last for only a few minutes, or for some it is few seconds, for some it is not at all, or for some people it may be for 1 hour or something, but it will not be extended to a day or 2 days. No. So for the time being, when you take the vaccine, until it settles down, you may face these problems, but otherwise everything is fine. So this is how you can expand the sentences. So Deepak, Moily, is that clear? Hello, Deepak.
Yes, understood, sir.
Yeah. So what more things? So what you have to do is, the points you are telling, they should be elaborated, they should be expanded a little, and they should be in step 1, 2, 3. First and foremost, there is a chance of aches. So the next, there may be tiredness, you may feel tiredness. And the third one is a nausea, you may have mild nausea. And lastly, there may be lightheadedness. These are some of the side effects, and these are not permanent effects. They are only temporary effects and short-term effects. They are not long-term. They may not last for 3 or 4 hours or something. It's temporary. So it will maximum it may last for 1 hour or 1.5 hour or maximum 2 hours. For some, it may not be. They may not be affected at all. It depends on person, place, time, and situation. So there is nothing to worry. So during this particular period, you should keep him under observation. Then after once it is done, then we will charge him or something. So according to the system, you go step by step, you explain. And fluency is a problem. First thing, the main problem is you don't have confidence. I don't understand why you are not, you're hesitating, you're feeling afraid, that anxiety, that tension is mounting. If you remove that tension, if they remove that anxiety, everything will be fine. So otherwise, you carry on like this one. So remove the tension, remove that anxiety, do as far as you can, as much as you can. Okay, however you can do it. That's it. That's what I can suggest you.